Hey YouTube. Alright, so um coming now off from that last video. Again, this is my second video. So the first one you saw was my first one I've ever made. Just kind of talking more about my transition and everything. So, excuse me. I ended up getting so when I ended up I ended up getting top surgery before even meeting with a therapist and before starting testosterone. I'm still not on testosterone. I still have not met with a counselor. I meet with a counselor on January 4th, 2016. So then I will, I haven't even been diagnosed with gender dysphoria yet, but just like how it's been for me growing up, always can relate to a guy more, always doing a lot of guy things and everything. I mean, like I said before, I feel like I'm a guy trapped in a female's body, you know, or at least I did feel like that. Now, since I got my top surgery, not so much. So, I got my top surgery before starting counseling, starting therapy, or testosterone because I have or had back issues, lower back issues. Um, so back around the time my fiance, who was my girlfriend then, I think it was about like 2 months before we started dating, I ended up in the hospital, and this was the first time my back went out. So I was 20. I was 20 at the time. I was 20, and so ever since then, I always had back issues. And I always thought, okay, so I'm overweight, or, I'm more on the heavier side. I thought it was because of that. And my mom thought it was because of that. And I'd always get it drilled into my head that I need to lose weight and what have you. And so I was in the hospital for about a month, or excuse me, about a week with my back. Getting out of the hospital, they sent me to therapy for my back. I bought a back brace. I worked out, did a bunch of core workout, everything. I was doing well, and then all of a sudden my back went out again. So then I just started all over again. And for the past 3 years, I have struggled with that, with my back, having back issues. I'll Ending of July made 3 years since I've had back issues, and that was when from 2012 in July, ending July 2012 to I want to say about October 28th when I had my top surgery. I always had back issues. My back always went out at least once a month. It went out once where I couldn't even walk. My fiance and my stepson had to carry me out to the car because I couldn't even walk, and that was the most scariest thing in my life. I was 22 at the time, not being able to walk, it really scares you. And so my fiance told me, "You ever thought about getting a breast reduction?" And I was like, this may sound stupid, but I was like, "Oh, I didn't know you could do that. I've heard of breast implants, not breast reduction." And so she was like, "Yeah, and you could, since you have a medical condition with your back, you could probably have your insurance cover it." So I was like, okay, just thought, it was always in the back of my head, and I was like, man, it'd be so great if I could get rid of my breasts, because I was a size E. So, that was a lot. And so I was up first week in August, I had my physical. Spoke to my doctor, told her, I would like to consult with someone about a breast reduction because of all the back issues I've experienced. And they agreed. They said, yes, you're pretty young. You're 23 years old to have all this back issues that you're having. It is not normal, and you have the rest of your life ahead of you. And I know when you wear binders, you have like indents and stuff, and so they're kind of going away now. But I had indents from my sports bras, and so I was like, okay. So got referred, and then I met with Dr. Umar Chowdhury at the U of M Medical Center, and he is the best surgeon. I've never had surgery before, so he was great. I loved him. I totally recommend him. Even if you're going, so I heard usually when they do breast reductions, like they don't take out the extra tissues and stuff, and they leave you with something called doggy ears. Well, for me, he took care of all that for me as well, and he was really great with the consult. And so when I had my consult with him, he asked me, "How small do you want to be? How small do you want to go?" I told him, probably never thought about that, but how about I'm like A cup, because I did not want my breasts. I hated them. They weren't something that I felt that was a part of me that showed who I was. It was something. It showed who I wasn't. And when I said that to him, he said, "Well, when you say A cup, you're telling me that you want to be totally flat chested." And my mom was in the room with my fiance and I was just like, I didn't say yes, but that was what I wanted to say. And so he told me, "You need to be honest with me and tell me what you want." And then he left the room. My fiance and my mom left the room. I changed, and he came back in alone. And I spoke to him, and he told me that with insurance guideline, he did have to remove all of my breasts because of my height and weight. The insurance guideline said I needed at least 1,200 kilograms removed, or 1,200 grams, one of those removed, so per breast. And so he was like, "Well, I'm definitely gonna get that, but it's gonna have to be all of it." And I said, "I'm totally fine with that." I had the nipple graft as well, so that was also another concern. He said to let me know, you're probably not gonna have sensation, you can't breastfeed, and I'm saying it's totally fine because my fiance and I have talked about that. If we had kids, she'd carry. So I met with him, had to go through insurance, get all that taken care of. I met with him in mid-August. I got my surgery approved in October, had my surgery October 28th, 2015. And so after I met with him, I went online on YouTube and I looked up, I wanted to see what my surgery would look like. And I looked it up, and then it was a female to male transition surgery that popped up actually. And that's when I just started getting more into this and researching and looking up like Aiden Dowling and Ty Turner and watching more and more videos just to find more stuff. Googling a bunch of questions, just research, just kept looking everywhere, for answers and thinking like that, that's how I feel. Like, again, this is going to sound stupid, but I did not know, like, yeah, there are people out there who are transgender, and you couldn't even tell by looking at them, and so I had my surgery, and I will show you, so I'm 8 weeks post-op. So, as you can see, it's still pretty raw, and he did a lot on the side, too, and I went from an E to flat-chested. And every time I met with him, I made sure I asked him, "That's what we're gonna do, huh?" I made sure it was nipple graft. I'm gonna be totally flat chested, where I didn't need to wear a bra, anything. And he was like, that's what you want. That's what we're gonna do. So I was fortunate that I was able. I was fortunate that my medical condition I had with my back, that I was able to kind of kill two birds with one stone with this. I have not had back issues ever since I had my surgery, and I feel so much more comfortable in my skin. And now is where I am kind of in the process of going to meet with a therapist now, finding out more about, transitioning, taking testosterone and things like that. Going forward, I do plan on working out, trying to just get my stomach tone, muscle tone, just get more leaner, you know, get more healthy. Just waiting to heal a little bit more. So, but yeah, so January 4th, I meet with a counselor, and so now you know why I had top surgery before I even met with a counselor or started testosterone. And I don't know if it's going to hinder me when I start testosterone because I had top surgery done, but I know a lot of people have top surgery after they've started testosterone and after they've been working out for a while. Unfortunately for me, because I was a size E and I was so large, I don't even think taking testosterone and working out, because I used to work out a lot, would even make my breasts go shrink, maybe a cup size. Even when I spoke to my doctor about that, if I told her I've been working out so much, and I hear the myth when you work out, women say you lose your boobs. Well, I never did, but now I'm thankful that I was able to get my top surgery, and feel more comfortable in my skin, feel more taking a step to who I am, who I want to be. I get called sir and gentleman and guy, a lot, and it doesn't bother me. I guess I can say a little bit of me cringes when for some reason some people still see that don't know me call me a like woman, or they can know, and that's kind of why I'm trying to branch away from that. And I know it's gonna be tough with my family, and my fiance. She's expressed that too, but yeah, that's pretty much with that. Just want to let you guys know why I got top surgery before I started counseling, and why before I started testosterone. And come January 4th, I'll know more on if I'm going to take, am I going to start testosterone, or what am I going to do? And so I got a lot of questions. So if you have any questions for me, feel free to ask me, you know. But yeah, you guys have a Merry Christmas, Happy Holidays, Happy New Year if I don't make another video, and take care.